All right, diving in today, and we're looking at dental care, but not just for anyone, for two very specific groups, pregnant patients and those over 65.
Two very different ends of the spectrum, but lots to consider for both.
Exactly, and that's why we've got all this material to dig into.
Really trying to get at those key points, making sure we understand how to best manage these patients' needs.
Because, well, it's different than just your average patient, right?
Absolutely. Different needs, different considerations.
So let's jump right in. Pregnancy first. I mean, so many changes happening in the body. You'd think maybe even routine dental care could be a risk.
You'd think so, but actually, the research is pretty clear on this one. Routine dental care. Generally safe throughout pregnancy.
Okay, so cleanings, checkups, all good. But what about, if you need a filling or something a bit more involved?
Yeah, that's where it gets interesting. Scaling, polishing, root planing, those are all considered fine anyway.
Basic cleaning, essentially.
Right. But the elective stuff, the restorations, extractions, root canals, those are best left for the second or third trimester.
Oh, interesting. So there's an ideal window. Why is that, though?
Well, think about it. First trimester, major organ development's happening, or organogenesis, it's called. Lots of critical stuff going on. By the second trimester, most of that's done. Plus, morning sickness usually eases up.
Makes sense, both for the baby's development and, frankly, for the patient's comfort in the chair.
Exactly. And for really big elective procedures, sometimes waiting until after delivery is the best option.
So, just something to keep in mind when you're planning things out. Now, switching gears completely, let's talk about geriatric patients, so those over 65. And here, it's less about avoiding procedures, more about how the body itself changes and what that means for dental care.
Especially when it comes to medications.
Right, huge topic. And our sources go into a lot of detail about physiological changes that can affect how drugs are absorbed, distributed, metabolized, and excreted.
All those fancy words basically mean the body handles drugs differently as we age.
So we're talking things like decreased body water, less lean body mass, changes in cardiac output, lower albumin levels, and often more body fat. What does that mean practically, though, for someone taking medication?
Well, take albumin, for example. It's a protein in the blood, and many drugs bind to it.
Okay, so it acts kind of like a carrier.
Exactly. But as we age, if albumin levels drop, more of the drug is unbound, meaning it's free to act in the body. So even a standard dose might have a stronger effect.
That's actually a really important point, isn't it? Like what seems like a normal dose could be too much.
Exactly. Then you've got changes in how the liver breaks down drugs. Liver mass and blood flow often decrease with age, so drug metabolism slows down.
So they stay in the system longer.
Right, and that can lead to increased risk of side effects and toxicity. It's all about being aware of these changes and adjusting treatment accordingly.
Being extra cautious, essentially. So what are some specific examples that dentists should be aware of?
Well, with local anesthetics, actually, there doesn't seem to be a huge difference. But opioids, those are trickier. You can see increased effects and longer duration, higher risk of side effects.
Wow, so pain management needs to be carefully considered.
Definitely. In some cases, starting with half the usual dose might be necessary.
Half the dose, that's a big adjustment.
It can be, but it's all about minimizing risk. And then you've got NSAIDs, ibuprofen, and that family.
Right, those are common for dental pain.
They are, but again, in older patients, they can cause problems,
Right.
higher risk of GI issues, and if kidney function isn't great, they can accumulate in the body.
So extra caution with those, too. Another thing that jumped out at me was drug-induced xerostomia, dry mouth.
Ah, yes, that's a big one. And it's so common because older patients often take multiple medications, both prescription and over-the-counter.
And many of them can cause dry mouth.
Exactly. And dry mouth is a huge problem for oral health, so it's something we really need to be on top of.
Absolutely. Finally, we got to touch on sensory changes.
Ah, right. Hearing loss, that's a big one. Affects a surprisingly high percentage of older adults. And taste can diminish, too, as we age.
So communication is key, making sure patients can hear and understand us.
Absolutely. And being aware of potential taste changes, too. It can affect how patients perceive flavors, even things like toothpaste or mouthwash.
Really makes you think about how those little things can impact the overall experience.
It all adds up.
So big picture, if we're thinking about these two patient groups, for pregnant patients, it's about timing, right? Making sure we're choosing the safest window for any elective procedures, balancing those needs with fetal well-being. And then with geriatric patients, it's about understanding how age-related changes affect drug responses and sensory experiences It's a whole different ballgame.
You got it. And recognizing that all these factors are interconnected, treatment timing, altered drug metabolism, sensory changes, it really highlights the complexity of providing good care no matter the patient's age or stage of life.
Well said. And makes you wonder, what other everyday healthcare interactions might have similar hidden complexities that we don't even think about? Something for us all to ponder. Thanks for joining us for this deep dive, folks.